Good afternoon, everyone. Thank you so much for joining today's Hep B Hangout. My name is Kate Morales. I'm the Senior Program Director at the Hepatitis B Foundation and Director of Hep B United. We're really excited to present today's Hangout session, Combating Hepatitis B Among High-Risk Communities, a Government-Community Partnership. Before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's Hangout. Please note that all attendees are in listen-only mode and you will be muted during today's Hangout. You may submit questions in writing during the presentation by typing them in the question box in your GoToWebinar control panel, and we will be reviewing them as they come in, and we'll hold a question and answer period after the presentations. Wanted to share a little bit about Hep B United. The Hepatitis B Foundation is a co-facilitator of the Hep B United Coalition with the Association of Asian Pacific Community Health Organizations, or APCHO. Hep B United is a national coalition comprised of over 30 national organizations and local coalitions nationwide to address the public health challenge of hepatitis B, which is the leading cause of liver cancer and the #1 health disparity for Asian Americans and Pacific Islanders. Our goal is to support and leverage the success of local community coalitions across the U.S., and we are working to raise hepatitis B awareness, increase screening, vaccination, and linkage to care. I want to go ahead and introduce our presenters today. And if our presenters can go ahead and turn on their webcams. Okay, and we'll start with our colleagues from the Centers for Disease Control and Prevention. Dr. Cynthia Jorgensen and Sherry Chen will be joining us to share resources from the CDC communications team, followed by Pavitri Dwivedi, who is a public health program manager with Hep B United Philadelphia. And then we'll end with highlighting our partner in Minnesota, and Dan Tam Fan Huang is joining us. She is the program manager of HBI Minnesota. Great. And I am going to go ahead and turn the presentation over to the CDC.
Thank you, Kate. I'm Cynthia Jorgensen. I'm sitting next to Sherry Chen. Both of us have been working on the Hepatitis B campaign. And what we wanted to do today was give you a little bit of behind the scenes of the development and sort of the reasons why we have developed this particular campaign. I'm seeing if I could hang on a second, making sure I can advance the slides. Are you guys seeing the screen? I clicked the sharing the slide, but I'm not getting them to advance.
Yes, I can see your screen.
Kate, can you see if you can advance it?
Sure. There you go.
I'm still on the front one. What slide are you all seeing? Are you seeing the second one?
I'm on the outline slide.
Okay. I'm still seeing the title slide. So what we wanted to talk to you all about today was just the development behind the particular campaign that has been called No Hepatitis B. What some of the research and background that goes into it, our sort of development process, and then highlight some of the campaign materials for you all. Do the next slide, please. So I'm hoping I'm getting this right?
Cynthia, sorry to interrupt. If you want to hit slideshow and then show presentation, it should advance.
That's the problem.
Screen.
Sorry about that.
Yeah.
I shouldn't. Okay. Thank you. Sorry about that, you guys. So many of you know this already, but the goal of the No Hepatitis B campaign is to increase testing for chronic hepatitis B. Our audience is Asian Americans, and this is a campaign that's actually in language. We have Chinese, Korean, Vietnamese, and in Chinese we have Mandarin and Cantonese languages. We also have the materials in English. And you all, as Hep B United Coalition members, are valuable partners with us in this campaign. We've launched the campaign in 2013, and since then have had two phases subsequent to that launch, including one that was released just a couple of months ago. We actually take a long time to develop the campaign. It's about a 12-month cycle. And as you can see from this particular slide, we begin with formative research, we draft concepts, we test those concepts, revise them, go into a fairly lengthy clearance process, shoot and finalize the materials before we implement it. And so this is the process that we are following with each of our campaign phases. So we also use behavioral science theory to guide the campaign and follow best practices for campaign development, including market research, formative research, testing our messages. And we're fortunate enough to work with a communication contractor, IW Group, which is an Asian specialty communication firm, subcontractor of our prime contractor, Weber Shandwick. So the rationale for our campaign audiences can be seen on this slide. If you look at demographic groups within the United States and language preferences, you can see that Chinese, Korean, and Vietnamese comprise the largest number of APIs in the U.S. Many of them are foreign-born and also prefer their own language. We do have a limited number of materials in the other languages that you see here, so we're trying our best with our resources to reach as many people as possible. We are also aware of how many people of various ethnicities prefer to get in-language information from in-language media. So this slide shows how common it is among various API groups. So what we do is we take the materials we develop in language and identify outlets that correspond to the various languages. And on this slide, you can see how many major outlets there exist across the U.S. and the various ethnicities. And so our contractor works with various media outlets in language to disseminate our campaign material. So this slide shows how we have a multimedia approach. You can see that we have print, TV, radio. We use news outreach with you all as through the Speakers Bureau. We do have a small digital presence that's also in language. And then we do new and digital media in English. And then we do have our PSAs on YouTube in the respective languages. So how we develop the campaign is we begin with exploratory research. So our goal there is to really understand the knowledge and attitudes about hepatitis B. And this past year, we were fortunate enough to have focus groups in Mandarin, Vietnamese, and Korean. They were translated for those of us who don't speak those languages. So what we were asking participants is just what do they know about hepatitis B? What is it? What causes it? How is it spread? How would people know if they have it? How do you find out if you would have it? What can you do about it? And so I wanted to share just a little bit of some of the findings that we have from that and show how we've sort of incorporated that into our campaign messages. So in terms of how common hepatitis B is, we heard over and over again that it's not that common here in the U.S. It was associated with sort of first world countries. They said the U.S. has high standards of hygiene and public safety, but hepatitis B is common in Southeast Asia. So you can see a quote there that only Asians in Asia have hepatitis B. We're more hygienic. People have their own plates. So they really saw it as sort of a non-U.S. problem. In terms of asking people what is hepatitis B, some people knew it was a virus, some people weren't sure. Symptoms, we heard over and over again about yellow eyes, fatigue, and abdominal pain. In terms of how serious it was, People weren't sure how serious it was. How hepatitis B was spread uncovered lots of different myths. As you can see here was unclean street food, raw and uncooked seafood, sharing food, drinks and utensils, and we've heard over and over again through the air. We don't know if it's being confused with tuberculosis as TB or whether this is just believed to be a virus that spread like the common cold or flu. In terms of preventing hepatitis B, we heard a healthy lifestyle. So if you exercise, rest, eat right, drink less, don't smoke, that's all preventing hepatitis B. And you can see from this quote, people are saying smokers and drinkers are more likely to get hepatitis B. You know, I heard sleeping better and eating better will help. So what we do with these findings is we incorporate them into messages that then get incorporated into our creative materials. So we wanted to try to emphasize both how common it was and how serious it was with some of the first messages in terms of 1 in 12 Asian Americans is infected, 2 out of 3 people don't know it, there's often no symptoms, letting people know that there's a blood test is the only way to know if you're infected. A key message I think you're going to see more and more is just that hepatitis B can lead to liver cancer, obviously making it very serious, and then trying to address some of the myths that we heard where it's not spread through air by sharing meals, bowls, or utensils. And just letting people know that it's spread when you come into contact with blood from an infected person. So what we do is we take that formative research and we actually develop message concepts. And from the message concepts, then we work with our contractor to develop draft messages in various formats. And what you see with this slide is we actually start with a lot more than we finally end up with. So we actually throw out more than you ever see on the end of the campaign of what's finally produced. So one of the key things we do is we pre-test these materials with our target audience, and we drop concepts or materials that aren't performing very well. We sometimes will identify elements that need fixing, and I'll show you an example of that in a minute. We revise the materials based on the feedback, and when possible, especially if something has changed significantly, we try to test it again, and then finalize the materials and send them through clearance. So what you see with this slide was actually 2 print concepts that did not test particularly well at all. So the first one is you're looking at a big threat to you and your family, trying to get at the idea of you don't see it, it often has no symptoms, very confusing to people. The next one right next to it with the father and daughter with the artwork was also confusing. People didn't understand what artwork had to do with hepatitis B. So these were 2 that were just not accomplishing what we wanted them to accomplish. So you haven't seen them because they test well. Here's an example of something that we tested that the gray version of this was what we tested in draft format and identified a couple of elements that people wanted to see fixed. The blue drops people thought was water. So you can see in the version right next to it, it got changed to red to convey blood. We also heard that it was a little bit drab. It didn't have a lot of color, so you can see that we added a green to match the Hep B United logo and changed the color of the doctor's shirt and just tried to make things a little bit clearer and cleaner and more colorful. So this is an example of how we got some good feedback and how we changed things. This slide is a video storyboard. As you can imagine, it's very expensive to shoot public service announcements, so we test them in sort of a storyboard format. We actually have a voice that's recorded in language and has slides sort of progressing on, it's like almost like a PowerPoint slide, so it's still photos, but it sort of gives you a sense of the dialogue in the action in the PSA. So this is what we test and we get feedback before we actually shoot the PSAs that were selected to be resonating with our target audience. So we have 2 new PSAs videos this year. They're in English, Mandarin, Cantonese, Vietnamese, and Korean. The first is featuring a father talking to his daughter. His daughter's trying to say, did you know 1 in 12 Asians is infected? Dad, you need to get tested. And the one with the no warning signs for hepatitis B is an animated PSA that addressed some of the myths that we heard over and over again in our focus groups. We also have a print version that corresponds with that PSA with the warning sign. And here you can see how we have it in English and the 3 other languages. So here's where you all come in. We develop these materials to try to educate people nationwide through ethnic media on a national level, but we also develop these materials to support you guys at the community and local level. So we have now a total of 4 video PSAs that are available to you. They're available on our website. They're also available for download, so you can either download them and play them or link if you have an internet connection to any of these. We have print materials and posters that are in the various languages, and I want to point out the father-daughter there has all 4 languages on it. This was a request that came from you all as community members, in that we heard that you don't have space for 4 posters in 4 different languages. Could we put all the languages on one poster because you serve multiple ethnicities? That's the type of feedback we want to hear from you. It helps us develop materials to help support you all. And this slide is an example of how some of the Hep B United members have taken our posters and actually localized them for their own use. And this is one of the ways we try to support you all, where we take on the cost of developing the materials and allow you all to localize them and use them in the way you feel best to support your local efforts. Just a reminder, we have a bunch of patient education fact sheets. They're in English and 7 Asian languages. This is where we are able to extend beyond the 3 primary Asian languages we do. We also heard from you all that you wanted to address people from Africa and African immigrants. So we have English and French fact sheet versions for people from Africa. And our hope is this next coming year we'll be able to extend, have a few more African languages. We also got a request for a fact sheet specifically for Native Hawaiians and Pacific Islanders, so that's also part of the suite we have. Here's an example of an educational infographic. This is something, again, trying to address some of the myths. It's sort of a visual education tool, and something, again, we heard that people wanted something that was a little bit more visual to support their patient education efforts. We also heard that many of you wanted interactive tools to use at your testing events and health fairs. So we have a quiz that we developed, excuse me, as well as a wheel that you can sort of spin. And I think one of our speakers coming up has a wonderful example of what she did with that. And then here are some low-tech templates for ads and flyers. This was another request we heard from you all of people often putting just flyers in windows and storefronts about the events that they have coming up. So these are also available on our website where you can localize and promote your particular event. We also heard that people wanted to do a low-tech version of assessing people's risk for hepatitis B, and that at screening events and health fairs, it was very helpful to have something in language about understanding where they were born and where their parents were born. So we have a 3-question sort of paper risk assessment, specifically focusing on country of origin as a way of identifying people who need to be screened for chronic B. And we also have some resources for follow-up with clients who test positive. The Living with Hepatitis B is just explaining what it is, how it's spread, but also is designed to have people bring their family members in for testing and explaining that they could potentially benefit from vaccination. We also had a request for a vaccine card so people could keep track of their doses. So these are other resources that are available on our website. And finally, we have some provider tools. The first one you see is an interpretation of Hep B serology, and the second one there is a reminder for physicians of who should be tested for hepatitis B, specifically focusing on API patients. And that concludes our talk. You have our contact information for me and Sherry, who's a critical person working on the campaign and keeper of many things. So get in touch with either one of us if we can help you or if you have questions.
Great. Thanks so much, Cynthia and Sherry. So we're going to move on to highlight 2 of our local partners. We'll start with Philadelphia, and Pavitri will be sharing about her work there in the Philadelphia API communities and other at-risk communities, and also showcase some of the materials from the campaign. Switch the screen back.
Hey everyone. I don't know if you can.
Let me move it to the correct slide for you.
Hi, can you see me, Kate?
I don't think your webcam is working, but your slide is up.
Okay, I'll just get started. Hi everyone, thank you Kate for the introduction. My name is Pavitri Guvedi, and I co-manage Hep B United Philadelphia. So, what is Hep B United Philadelphia? Hep B United Philadelphia is a citywide, community-owned coalition and campaign that is led by the Hepatitis B Foundation to really increase hepatitis B testing, awareness, linkage to care, and vaccination among high-risk communities. We are a coalition of over 75 organizational partners, including the Philadelphia Department of Health, social service organizations, providers, and hospitals. Through our collaboration, we have our community stakeholders that helps us coordinate city services and resources to make an impact in order to address this serious public health concern. Just to make this a little clear, Hep B United Philadelphia is a local coalition under the Hep B United National Coalition umbrella, which helps us address hepatitis B and liver cancer public health priorities and share resources with partners around the country. Is the camera working, Kate, or I can't see it?
Not yet. I want to try sharing it again.
Okay, I'll just keep going. So our goals and priorities are, one, to really promote hepatitis B testing and vaccination, especially among at-risk populations, and to also stimulate community engagement in order to improve access to care for both prevention and treatment to reduce the local burden of hepatitis B and liver cancer. So you may wonder, why a coalition in Philadelphia? So as you may know, hepatitis B is an underdiagnosed and underprioritized disease in Philadelphia. Over 20,000 Philadelphians are estimated to be living with hepatitis B. Unfortunately, among high-risk groups, only 10 to 20% have been tested, where most still remain undiagnosed and unaware about their serious risk for cirrhosis and liver cancer. Actually, in 2013, the Philadelphia Department of Public Health received 508 new reports of chronic hepatitis B infections, mostly among the AAPI's communities, which really shows you how alarming this issue and this disease really is. In order to increase awareness and testing, since 2007, we have held over 65 screening events, educating over 10,000 people through outreach and awareness. We have also provided direct education to over 2,500 and screened over 2,700 individuals. Here, the findings show that among those that were screened, 98% were foreign-born AAPI, 60% uninsured, and 90% with limited English proficiency. We also found an overall 8% infection rate, with 58% immunity and 34% susceptible with hepatitis B. The highest infection rate was 13% in Chinese communities, 10% in Vietnamese, and fairly similar among refugee, Korean, and Indonesian populations. So I wanted to give you a quick overview of our 2015 and 2016 screening events. Through our efforts, we have been able to screen in local churches, schools, health fairs, and community events. I really want to emphasize that our screening efforts are successful because of the partnership and support we have been able to build with our local partners over the years. And it took us a lot of time to gain the trust of the community and have a presence in the Asian communities in Philadelphia. So the medical students are actually a key component at our screening events. Hep B United Philadelphia works very closely with APAMSA, that's the Asian Pacific American Medical Student Association group. And although I may like to know all the Asian languages, I really don't. So it's really nice to have a resource, especially from the students, who can provide us with language assistance to help out with screening forms and also explain the importance of getting tested. The students also offer free blood glucose, blood pressure, various other health screenings as well, which is really important because, as you may know, there's a lot of stigma and fear with hepatitis B, where someone may not want to come to just a Hep B screening event. So by incorporating other services, you make it into a health fair where hepatitis B is one of the services they can get for free. So this way you're giving them hepatitis B services, but it's not just only focused around that. So how do we promote our screenings? Well, of course, through the wonderful No Hep B materials. One thing that I really like is how appealing and colorful these resources really are. And we're very thankful to have access to free No Hep B materials to help us promote language appropriate and easy to read materials in Asian communities. Like I mentioned earlier, 90% of the people have low English proficiency. So it's really nice to have information that's in the language that they're familiar with. And this is an example of the flyer that we use for one of our screenings. And it makes it so simple to just quickly add the location, time, and date of your event and really help promote in a larger community. I really want to show you the wheel. Okay, so along with screening and testing, we do a lot of outreach and awareness through various community events. We are part of research days, community health fairs, and also organize outreach events through presentations and information sessions. And here you can see there's a picture of coalition leaders at the Rocky Steps with Councilman David O. at one of our May events. I'm going to try, just give me 1 second, I'm going to try to see if this works, Kate. I wanted to show you all a wheel that I have created. So hopefully the webcam will work now. Hi, okay. Can you see me now?
Yep.
So as I already mentioned, you can go to the next slide. We love using the different CDC No Hep B materials. On the top left corner, you can see we have Councilman David O. with one of our very own health wheel that we created using the guidelines that were posted on the No Hep B website. And this really makes the education component more interactive and actually getting people more interested to learn about hepatitis B. So I have the wheel right here with me, and it also spins, and there's a liver at the bottom. So this was really cool because I decided not to put anything on it because I wanted to use it for different community events and not put any English on it, so this way more people come. And we also use the quizzes that they have on the No Hep B website to when we were using the wheel. And this, again, is quick facts that people get to know about hepatitis B, and it's very interactive and very easy to learn. So The students on the bottom left corner, you can see, also love using the posters. It really makes people more drawn to the information booths and also see resources that are available in the language that they are familiar with. And on the right, we have our very own Dr. Cohen with the new no warning sign posters at our recent May Hepatitis Awareness Luncheon. So here, I always have them with me. Again, this is in Vietnamese. It's one of the fact sheets that Cynthia and Sherry showed. And it's really nice because it's in English and Vietnamese. So if there's a question that may come up, you can see the English part because, again, I don't speak Vietnamese. But it's nice because that way I know what they're referring to, and I can use one of the interpreters to answer the question they may have. Moving on, and these are free to download, again, as Sherry and Cynthia mentioned. Hep B United is very active on social media, promoting our upcoming events and all the other community events that we are part of. We have close to 300 followers on Twitter and almost 600 likes on our Facebook. As you can see, we continue to grow. We had only around like 200 2 years ago, and we have grown a lot since then. So if you don't already, please follow us on social media to learn more about our outreach efforts. And in order to keep hepatitis B a public health priority, every year during the month of May, we co-organize a hepatitis awareness event with our Hep C Coalition to engage more city council members and collaborate our efforts on this issue. Last year, we had over 70 representatives at the city council briefing, and actually a week ago, we held a press conference with city council members to address hepatitis B prevalence in Philadelphia, along with the growing rates of liver cancer. And a very fun fact, we were actually able to get media coverage for this, and on the 6 ABC Evening News. So Kate, if you want to try to play that. And there's no sound, but basically it talks about the briefing, the press conference that we had, and really shows how committed our coalition members are and the students that we have.
They're urging city leaders to provide more resources to stem the virus, which can cause liver cancer. Councilman at large David O. was among those participating in today's demonstration.
Thank you. And before I move on, you may be wondering what the giant red liver is. So that's our very own Philly's liver, Oliver. And he comes to all of our briefings and major citywide events, so it's always nice to have more support from Oliver. And in order to address hepatitis B in Philadelphia, we really still need to see increased screening, linkage to care for infected individuals, and more education to reduce myths about hepatitis B. Some of the barriers that we have found among AAPIs include fear, stigma, discrimination, language, as we already saw before, and inability to navigate the healthcare system. Providers still lack appropriate hepatitis B knowledge and have difficulties communicating, especially with people who have limited English proficiency. Next slide. So we're really fortunate to have a large and committed coalition of community members. As you can see, they are always there with lots of energy and passion, and we're very thankful to have a group of people who are very committed to this issue. We also have resources to provide training to improve knowledge in communities along with the providers in the communities. However, we still need to find ways to improve community and provider awareness, to improve screening rates in Philadelphia. We also need to get more media presence to raise awareness and promote our testing opportunities. We still need to find ways to make system-level changes to really make hepatitis B screening and appropriate linkage to care a routine in Philadelphia. And we genuinely believe that this is possible with engaging more city leaders, hospitals, and current medical and nursing students. So with that, I want to say thank you, Hep B United, and also a huge thanks to Cynthia and Sherry to help us in Philadelphia make our outreach efforts successful. And if you have any questions, please feel free to reach out to me or Dr. Sherry Cohen, who is the Director of Public Health at Hepatitis B Foundation. Thank you.
Thanks so much, Savitri, and glad you were able to share your materials. So I'm going to go ahead and introduce Dan Tam, who is with HBI Minnesota. Dan Tam moved to Minnesota, and she'll tell you more about that from the DC area, and is newly established HBI Minnesota. So Dan Tam, if you can share your screen, feel free to do so now.
Okay. Can you see it?
It popped up briefly. There we go.
Okay.
We can see you. And then if you want to share your slide, and then just hit play from the beginning. Show slideshow.
Like that?
Great. Let's see.
It says on air showing screen.
There you go.
Okay. So you can see the screen?
Yes.
Okay. Okay, hi everyone. My name's Dan Tam. I'm HBI Minnesota's Program Manager. Okay, how do I advance the slides? Okay, so like Kate mentioned, a little bit about us is we started in October 2015, and we're a nonprofit that provides free hepatitis B and C education, testing, and linkage to care. We also do referrals for hepatitis B vaccines as well through public health partners. We work with those who are underserved, so we try to work with community leaders to ensure our resources are linguistically and culturally appropriate, and we know that the population we work with generally does not go to the doctor, so we provide direct services in easily accessible areas such as offices, markets, festivals, churches, and so on. And for those of you who know Jane Pan and HBIDC, I actually worked with her for 2 years as the project coordinator. So HBI Minnesota is the Minnesota chapter of HBIDC. And through that work, I was able to work with a lot of people, everyone from Laotian, Chinese, Vietnamese, Korean, Cambodian, Thai, Burmese, and African communities as well. So I was able to acquire cultural competence that way, and I was aware of all the challenges we would encounter once we started here. And why Minnesota is what everyone asked me. I actually grew up here. I went to school here, and I went to DC for graduate school. Recently, I moved back home and realized no one else was addressing Hep B and Hep C in underserved communities. So I've always been passionate about alleviating healthcare disparities. So with my past experience in DC and my passion, I decided to start a Minnesota chapter of HBI. And since October, we've been working with community leaders, government agencies, and healthcare providers to put on these events. So for outreach purposes, different types of ways we would do is we would table. So the upper left-hand corner is actually a picture from our National Hepatitis Testing Day, where we did testing at Neighborhood House, but then I also tabled at the St. Paul Ramsey County Public Health Department just so that the refugees can come in and learn about hepatitis, and we have multilingual products. You can see CDC's fact sheet on the table as well. Another way is also through visuals. So we try to be interactive as possible because some of the people we do speak with, they either don't read or write or they don't speak the language. So having liver models such as that one or that one where they can feel is always great. And then we also work with community leaders to ensure resources are culturally appropriate. So this is, right now we're focused on the Hmong community. This would be a flyer in Hmong and some of our partners as well at the bottom. Okay, so at the chapter, we were in a downtown international market, and for that event, we actually partnered with the minority health group at the medical school. So we were able to actually reach a lot of African communities that way. The lower left-hand corner, to reach the younger people, we partnered with Neighborhood House, which is a huge nonprofit that does HIV awareness. And they actually are connected in the Hmong community at different bars that young adults go to. So I actually went with Dee, who's the API health educator, and we would go around educating people about hepatitis B and C, and a great conversation starter was actually using this liver, because a lot of people actually do not know what your liver looks like or does. At the bottom right-hand corner is an event with CAPI USA, which is a refugee nonprofit group, and they were able to get a lot of Hmong elders to attend this event, and it was held at a library. So we were able to outreach to the elderly that way. And thanks to media presence, we've also been supported. So they come and record our events. The upper left-hand corner, we actually filmed a Hmong talk show about hepatitis B that, as you can see, has been viewed 774 times. And what's great is that we're able to share this among our social media. On the upper right is Hmong Times, which is one of the 3 popular papers for the Hmong community. And it's actually published in English, so I was able to write an article raising hepatitis B awareness, especially about the stigmas. The bottom left-hand corner was actually our April event at one of the Hmong markets, and these are 3 of our high school volunteers who were very creative in ways of recruitment. They actually had a sign on the back of their shirts that said, "Come to the health screening." They also went around with liver models, and they were very interactive with everyone, including handing out vouchers to the vendors. And then our most recent event for our hepatitis testing week was the bottom right, and this is actually on Hmong TV network. They actually had us on the news, and this is just a screenshot of it. Okay, so in addition to media, we also are very active on social media, and these are some of our top tweets from Twitter in May. As you can see, one of the CDC infographics people liked because it was very visual, and again with the Hmong and English flyers. At the bottom, we also use Facebook to outreach to a lot of people. It's not just for young people anymore. So we actually, how we do is we co-host with different partner organizations. For this one in particular, we co-hosted with the Hmong American Mutual Assistance Association, which is the main Hmong nonprofit group, and they were actually able to share it with 853 people, which is great. And then we also kind of recap our events as well. So we have a blog on our website that kind of, after our big events, we write about what went on, what we learned from it, what types of thoughts, and including some pictures. So this was Hepatitis on the Hill this past March with different advocacy groups. And this is what a typical setup would look like. The upper left, since this building was unmarked, we actually had a sign and balloons in the road so people can find it. And we would typically have 3 stations. We have a station where people would register. We decided to use clipboards because that eliminates the need for a table. And then phlebotomy stations, and of course education. In this case, since it was an ongoing crowd, instead of having a speaker such as a doctor, we had a public health video playing in the background that actually was spoken in Hmong with English subtitles. And if we have enough space, another way to support ourselves is to ask for exhibitors. So these are some of our supporters. We have Hennepin County Public Health, Gilead, and Blue Cross Blue Shield as well. And these are 2 of our volunteers from actually the University of Minnesota Liver Clinic. So as I mentioned, we started in October 2015 for outreach, but our first event wasn't until February 20th, which was the HBI Minnesota kickoff. And as you can see, we started off very slow when it was colder out, but once the summer months picked up, we've had a testing week. We have a few festivals we will be attending as well. And of course, we would not be able to do this without the help of our testing partners. So these are some of the partners that we've partnered with to do testing. And we also have a very large linkage to care team. The two ladies on the left are our phlebotomists who work with some of the doctors. And the person in the blue is Dr. Amar Magoob. He's been great. He was actually the one who provided the liver models for us to use at our outreach events, and he works at the University of Minnesota Liver Clinic. The guy in the black suit, that's Dr. Molo. He's Hmong speaking, and he's been our main Hmong speaker, so I've had him be on TV, radio. The guy next to him is one of the Gilead researchers, and the far right in the red is Dr. Ibrahim Hanoune, who works at Minnesota Gastroenterology, which is one of the largest GI practices in the state. And we've also tried to do some policy work. I've met with Councilman Dai Tao, who is the councilman for St. Paul, Frogtown area, where there is the most prevalent Hmong population. Along with this, Maitini is one of our phlebotomists, and this is actually my brother volunteering with our events. And this is a mayor of Maplewood City, another town that has a lot of Hmong people, and a House Representative, Joanne Ward, who actually has been very active in sharing our events on her social media. In addition, I also met with Senator Fong He, who is a state senator, and he is trying to pass a hepatitis B bill that would increase funding for nonprofit work relating to hepatitis B. So here's my contact information, and you can also find us on social media. Thank you.
Great, thanks so much, Dan Tam. So we're going to go ahead and begin the Q&A portion of our Hangout. And I'm going to switch the slide back here. Oops. Sorry. So please, as a reminder, feel free to submit your questions in the question box for any of the presenters, and then we will direct them to the appropriate person. So we have a question. The first question is about the CDC materials, if the links will be made available. So the links, we will share a copy of the slides after today's presentation, and they will be posted on our website. And I'm also going to type in the link in the chat box for the CDC website now, and that will lead you to all of the materials that Cynthia shared today. Cynthia, did you want to add anything?
No, basically if you go to cdc.gov/hepatitis, that's our main page, or you can go to cdc.gov/no-hepatitis-B, and that goes directly to the campaign pages, and you'll see that the materials are organized by language. And on each of those tabs, you'll find everything we have in Chinese, Vietnamese, and Korean, and then also in English.
Thank you. And then our second question is around, this is for Dan Tam, and how is HBI Minnesota funded?
So right now we have mainly one pharmaceutical grant we're working with, and so far it's kind of like a proof of concept. The more that people see what we're doing, the more willing they're able to fund us. Another way of sustaining ourselves has also been having vendors exhibit at our monthly health events.
Our next question is for Cynthia. Are there no hepatitis B materials that address stigma or the fear of getting tested?
We don't really have anything that addresses the fear of getting tested. We've tried to indirectly address the stigma by addressing some of the myths, by saying hepatitis B can't be spread by sharing food, or we don't use the word casual contact, but being around people. So we've tried to address the common fears we've heard, and that's our way of addressing stigma. The other thing we've tried hard to do in our video PSAs is show very normal, ordinary-looking people doing normal, ordinary things as a way of having people identify that that could be their family or that could be them.
Thank you. And then for Pavitri, can you describe if there have been any barriers or challenges that you've encountered in the, and I guess this could also be for Dan Tam as well, if you, in terms of getting from your experience in HBIDC, whether you have encountered any barriers or challenges in reaching out to new communities as it relates to the fear of getting tested or process-wise in your outreach. Pavitri, do you want to go first?
Yeah, sure. So one of the biggest barriers that I've seen in the past 2 years is really reaching out to the African immigrant communities, because I believe that they're fairly new compared to the Asian communities in Philadelphia. So we're still struggling to build that relationship, but through our outreach events, like what we usually do is attend their community health fairs and any events that they are organizing to really get the word out, let people know that there are services that they can use for free. So we are trying different outreach efforts to really build that relationship, but that's definitely one of the biggest barriers.
Yes, I would agree with that, because actually in the Hmong community in particular, they feel like if you take their blood, it's kind of like taking a part of their soul. So we kind of have to combat that by working with those who they respect, such as the clan leaders, the different elders whom they look up to. So that's why I never actually go out into the community and do outreach myself. I always have a partner. Whether it's Hmong American Partnership, which is a very large nonprofit here that's very well known, or someone well respected in the area, such as Hmong Healthcare Professionals Coalition. And they're a coalition that has been around for 20 years and are well known in the community for health resources. So definitely that's where partnerships come in, and that's why we never just go straight into the community. We always work with someone else who they already know and are familiar with.
Thank you. And then next question for Cynthia. Can you address if there are materials some of the materials that are available for someone who has hepatitis B?
Yes, we have a couple of fact sheets for people who have hepatitis B. There's one that's on the slide set that says living with hepatitis B, and that one's specifically designed for someone who has been told they have hepatitis B and explains a little bit what they need to do to take care of themselves. And it also encourages them to bring their family members in for testing and explains that they could benefit from vaccine. So that's a fact sheet that we have specifically for people who have been diagnosed. We don't have anything on hepatitis B treatment. That's not really CDC's strength and expertise, so we sort of stop with here's what you can do to take care of yourself, make sure you're getting care and treatment followed by someone, make sure your family members get tested.
Okay, great, thank you. Our next question is for Pavitri and Dan Tam. The question is, what is the success rate in linking people who are diagnosed with appropriate long-term care and treatment? Dan Tam, you want to take that one first?
Sure. So we actually, since we have a wide network of providers, so far it's been well, and we haven't had that many events, so we haven't found that many positives. However, just working with federally qualified health centers and providers who can speak their language have really aided the process. So I'd say right now it's 100%.
Hi, sorry, I was having trouble unmuting myself. Yeah, it's pretty high, but I feel like one of the biggest challenges that I face is actually doing a follow-up. Sometimes I have to call people multiple times for multiple weeks to let people know that they might be not immune to hepatitis B, and making sure that they understand the results, because sometimes when someone sees positive next to a result, they think it's a good thing, and then they don't do any follow-up. So it's really important for us to keep calling until we hear back to make sure that people actually understand what the results mean.
Interesting, thank you. Our next question, and I think all three of our panelists might be able to address this from different perspectives, whether all pregnant females, the question is, are all pregnant females tested for hepatitis B in your communities, and are they referred to the perinatal hepatitis B coordinator and for a local health department? Cynthia, you want to take that first?
Well, as many of you may know, we work with our partners in the immunizations division. They oversee the programmatic aspects for the perinatal prevention program, and their goal is to make sure that mothers are tested during pregnancy and that babies receive appropriate prophylaxis at birth. They are also working with us to try to get that linkage to care for the mom. But I'll let our other two panelists talk about what happens in their particular communities.
Kavitri or Dantam?
Sure. So I know the St. Paul Ramsey Public Health has a great perinatal B program because we've partnered with them and we've spoken about this. And they actually do house visits. If they test positive, then they actually also try to test their whole family as well. So I'd say their program is great. I'm not familiar with the other programs, though.
And Kavitri, did you want to share, there's been experience with pregnant women in Philadelphia? I think she might be on mute. I will, from a policy perspective, just share what we've seen at the national level. The statistic is that 800 to 1,000 babies are still found in the U.S. Who are born with chronic hepatitis B, and that's unfortunate. And I think that there is a breakdown in some of the systems, and there are pregnant females or babies that are not getting vaccinated, or prophylaxis that are falling through the cracks. Also, if you look at the different state laws and the mandates, there is also certain states that still are, not all states, I guess, would say, mandate hepatitis B screening for pregnant females. So there are a lot of gaps that still need to be addressed, but we do see that perinatal hepatitis B can be eliminated, and we are working closely with our stakeholders to address that. And again, when your question was, are they all referred to the perinatal hepatitis B coordinator? We certainly hope so, but that may not always be the case. Okay, and then any other questions? Okay, and we can take one more. So this last question is for Kavitri and Dantam, and I'll also ask Cynthia if there are resources to address this issue. So the question is there any outreach to homeless or groups with ties to intravenous drug users? And Dantam, I know you work on both B and C, so you may be able to address some of that, the risk groups for that.
So right now we're actually focused with the Hmong community. However, we have connected with some people who have used IV drug uses. There is, I forgot what's his name. I think his name is Lee. He actually runs a syringe exchange program on the street. So keep him updated about our events, and I know he reaches out to the risky community who is the drug users. So that's all I know, though. They haven't been to any of our events, though. But I just kind of keep them on our listserv of events, and if they're interested, then they would come by and get free testing as well.
Great. And then, unfortunately, Pavitri isn't able to unmute herself, but she is providing an answer online that for Hep B United Philadelphia, they are focused on Asian American Pacific Islander communities where sometimes people don't have a permanent address. So they asked the church to see if it would be okay to send results to the church, but not. They haven't done a lot of work with IV drug users. I know that Philadelphia does partner, or Hep B United Philadelphia does partner with HepCap, which sees more hepatitis C infections in those communities. And then, so we do have a comment, and this addresses, and I just wanted to read it out loud so that our questioner on perinatal hepatitis B is addressed. This person is from Houston, and she says, FYI, it's not the case in Houston. They are still missing cases there. Hospitals and providers are not reporting all positive Hep cases among pregnant women. So that is one city where we do see a problem. And Essie, if you want to get in contact with us, we'd love to learn more about that, about the missing cases that you are seeing, and hopefully we can work together to address that. Okay, so if there are no more questions, we've also reached the top of the hour. I wanted to thank everyone for joining today. Thank you for that rich discussion. If you have any follow-up questions that you can think of after this, feel free to send them to our email address at connect@hepunited.org. Lastly, I want to thank you so much to our panelists, Cynthia, Dan Tam, and Pavitri, for sharing your resources and insights from Philadelphia and Minnesota today. If you want to learn more about our local campaigns, in addition to our two panelists today, feel free to visit our website, hepunited.org, and click on local campaigns, and there you'll find a list of all of the other organizations that are working to address hepatitis B in your communities. And please join your local coalition, or if you're interested in joining Hep United, connect with us via email. And finally, look out for a message from Hep United upon closing your window. We would appreciate your feedback on a short survey. Thank you again, everyone. Have a great day.
Thanks,
Thank
Kate.
you.